Hello, everyone. I'm Chris Bratton, founder of Bratton Law Group, and welcome to another episode of Coffee with Chris, where we provide you with information in the areas of legal, financial, and healthcare advocacy. Very pleased to welcome my guest today, Dr. Tracey Harris, who's a physical medicine and rehabilitation specialist at Virtua Health. She's been in practice for more than 20 years and affiliated with multiple hospitals in the area. Tracey was supposed to be on a panel discussion that we recently had, but emergency kept her away, so I wanted to follow up with her in order to get her insight of what's going on. Tracey, welcome. Thanks so much for coming on today.
Thank you, Chris. Thanks for having me.
I appreciate it. So we're still in the middle of significant restrictions due to the pandemic, although there's now some easing in place, but the effects are still lingering and affecting our population, especially the aging population. So can you give us your opinion on some of the short-term and potential long-term effects of COVID in the elderly patient population from a self-care and mobility standpoint?
Sure, I'd be happy to. Yes, we are getting a little bit better here in the state of New Jersey, but we are still seeing the impacts of COVID in all patient populations, particularly the elderly. The elderly population, as we all know from the news, is more affected, and they are already significantly affected from other things, including just all of their comorbidities. So what we're seeing from the mobility and ADL standpoint is the way COVID affects the body, it affects the lungs most specifically. So people don't realize how much effort it takes for dressing and bathing and just basic walking around. So that's what we're seeing in the elderly population, is that they're having a decline in their self-care skills and they're needing more assistance with their self-care skills. So that's, I think, where it's affecting them the most. We're also seeing some issues with cognition, and I don't know if there's any specific ties that the CDC or any of the scientists have found with cognition in the elderly, but we are seeing that impairment as well.
Now, if they're coming into to rehab setting and then trying to get home, is the focus really trying to get them back on their feet, maybe to increase maybe the lung capacity so they can do some of the activities of daily living as they normally would?
Yes, it is. The focus is, as it would be with any rehab patient, is to return them to their prior level of functioning. We don't have a specific COVID plan in place. They're basically treated as any deconditioning patient would be. We're just seeing that they're affected a little bit more because oftentimes they come to us and they are on oxygen, or they are on vapotherm, which is a high flow oxygen, which they're not used to being on. So once they're weaned from the high flow oxygen and down to regular oxygen, just carrying an oxygen cord around behind you is something that some elderly people aren't used to doing. Some are requiring walkers. As walkers, when you use a walker, it requires less energy, for you to walk or transfer. So those are the things that we're focused on, getting them away from the oxygen, getting them off of an assistive device if possible, and returning them to their prior level of functioning.
Okay. Now, in trying to resume some routine healthcare and outpatient physician visits, a lot of the population still have some fear about going out, and their well-being about going into a place where there's more people, as far as rehab or just simply doctor visits themselves. And we certainly don't want their health to decline because they're not going to see the doctors. So what are some of the precautions that doctors and offices are taking to ensure patient safety and confidence?
You can start with the outpatient visits. Most doctors' offices, I know I work for Virtua, and they are screening the patients prior on the telephone, and then they are having them come in and they're sort of re-screening them when they get there. When you arrive at the doctor's office, they do have the patients distanced in the waiting room. If they aren't able to provide the distancing in the waiting room, say it's a small doctor's office and they don't have the area to do that, then they will have the patients sit in their cars or with whoever brings them to the appointment. They will send a person out to the car to do any of the intake information, and then they will give them a phone call when it's time for them to come in and visit the physician. All of the physicians' offices are provided with the appropriate PPE or protective personal equipment so that the patients can feel safe when the doctors or their staff is coming into the room to do their assessment. And a lot of the records are online, so that's helpful too. I've seen in the office myself that when you do come in, if you have to write something, there's one pen, you write with that pen, and then you take that pen with you. So there's less chance of cross-contamination. As far as coming into the hospital for procedures, they are requiring COVID testing prior. So that way the patients can feel comfortable that they're coming into the situation knowing that they're negative, and the staff, again, is provided with all the proper PPE for all procedures in the hospital. So I think that they should feel confident that the doctors and the hospitals are trying to provide the safest environment for patients to get the care they need. Because if they don't get the care they need, they're going to end up in a worse situation.
Right. Let me ask you one question, I apologize, I have to plug my laptop in. If we're preparing for a second wave, if it is coming, what are the hospitals doing? What are the doctors' offices doing to prepare for this? And again, hopefully make sure it's not as significant of an impact.
I mean, I think it's along the same lines of everything else that we've been doing. I think a lot of it is personal responsibility, masking, hand sanitizing, making sure that you're performing the social distancing as required. And then all of the preparation as far as screening the patients when they come in. And the problem, I think the biggest concern is that it's abutting against the flu season. So they're encouraging everyone to get their flu vaccines and get them early. That way you're at least preventing one illness possibly, as opposed to trying to figure out when this and if the second wave happens, what we're dealing with. I also think that the doctors now have a better idea of how to treat COVID, which we didn't when it first came out. Not that there's a cure, because I'm not saying that, not that there's a specific treatment, because I'm not saying that either, but I think they have a better idea of how to manage the disease, which we didn't have when it first came out in the beginning of 2020.
Yeah, we really had no idea what was going on at that point. I think another factor in this that I'm not sure how much we took into account, but I think we're seeing it a lot more, is the mental health status and well-being of patients. And even not only those individuals that have COVID or those individuals that are self-isolating in the house for fear of maybe contracting it, but what about those patients who have been hospitalized for non-COVID reasons and are unable to see their family members due to restrictions? How is that affecting their mental health and their recovery?
It's tough. It's tough in the hospital. It's tough in the subacute facilities. It's tough in the long-term care facilities. Over the last, I would say, month or so, the hospitals have opened up a little bit. So we are providing visitors hours. At my hospital in particular, it's between 2 and 6 p.m. You can have one visitor up to see the patients. So I think that that's definitely helping. But during the peak and the height of it, it was very isolating. I mean, imagine it was isolating for us. People that could come and go from our homes as we liked, go to the grocery store, to be in a hospital and not have a loved one or a family member be able to come in and just comfort you and visit you was very difficult, and it took a mental toll. We did initiate a Zoom program, and each facility was provided with a laptop or some sort of device so that the families could at least Zoom with their loved ones, but it's still not the same. So yes, it took a significant toll, but I'm glad things are opening up now so that they get a chance to see their loved ones.
Yeah, absolutely. I know you're very busy. I don't want to keep you today. I appreciate you coming on. Everyone appreciates all the insight that you're able to give. Thank you for joining us. If anyone needs to reach out to us at Bratton Law Group, you can give our office a call, 856-857-6007 or brattonlawgroup.com. Dr. Harris, thank you again so much. I appreciate you coming on.
Thank you. Stay safe, everyone.
Bye.
Bye.